Understanding Alzheimer's disease. A comprehensive overview. Alzheimer's disease is the most common cause of dementia, a group of brain disorders that progressively erode memory, thinking skills, and the ability to live independently. While there is currently no cure, understanding the disease, its causes, symptoms, diagnosis, and potential treatments is crucial for those affected and their families. What happens in Alzheimer's? Alzheimer's is a neurodegenerative disease, meaning it involves the gradual loss of brain cells. This process disrupts normal brain function, starting with mild memory lapses and eventually leading to severe cognitive decline. Though the exact mechanisms aren't fully understood, the disease is believed to be caused by a combination of genetic predisposition, lifestyle factors, and environmental influences. The disease isn't just about forgetting things. It impacts personality, judgment, and eventually, even basic functions like walking and speaking. This makes Alzheimer's a devastating illness for both the individual and their loved ones. Recognizing the signs. From early to late stages, Alzheimer's progresses through stages, each marked by distinct symptoms. Early stage, mild forgetfulness, difficulty recalling recent events, misplacing items, and struggling with complex tasks are common. People may repeat questions or get lost in familiar places. Intermediate stage, memory loss becomes more pronounced, impacting daily life. Individuals may have trouble with speech, visual perception, and making decisions. Mood swings, anxiety, and irritability are also typical. Late stage, severe cognitive decline leads to delusions, aggression, and difficulty with basic functions like walking or communicating. Individuals require round-the-clock care and may become bedridden. It's important to note that occasional forgetfulness is normal with age. The key difference is the persistence and progression of these symptoms. Diagnosing Alzheimer's. What to expect. There is no single test for Alzheimer's. Diagnosis involves a combination of medical history, physical exams, cognitive tests, and sometimes brain imaging, MRI or CT scans, to rule out other causes. Doctors may also look for biomarkers, such as abnormal levels of certain proteins in the cerebrospinal fluid, which can indicate the presence of the disease. Treatment and AMP. Management options. While there's no cure, treatments can slow cognitive decline and manage symptoms. Medications. Drugs like lecanemab, Leqembi, and donanemab, Kisunla, have recently been approved to remove amyloid plaques from the brain, potentially slowing progression. Other drugs, such as donepezil and memantine, can temporarily improve cognitive function. Lifestyle interventions. Regular exercise, a healthy diet, social engagement, and mental stimulation can help maintain cognitive health and potentially delay the onset of symptoms. Supportive care. Counseling, support groups, and caregiver assistance are essential for managing the emotional and practical challenges of Alzheimer's. Research is ongoing, with scientists actively exploring new treatments and preventative measures. Risk factors and AMP. Prevention. Several factors can increase your risk of developing Alzheimer's. Age. The risk increases significantly after age 65. Family history. Having a first-degree relative with the disease raises your chances. Genetics. Certain gene variants like APOE4 are associated with higher risk. Lifestyle. Poor diet, lack of exercise, smoking, and untreated cardiovascular issues can contribute. You can take steps to reduce your risk. Maintaining a healthy lifestyle, managing chronic conditions, and protecting your brain from injury are all important. The bottom line, Alzheimer's disease is a devastating illness, but it's not an inevitable fate. Early diagnosis, lifestyle interventions, and ongoing research offer hope for slowing progression and improving quality of life. Understanding the disease is the first step toward effective management and a future with better treatments.